This training module will familiarize you with the most common visual diagnoses in the optical industry and how each disorder affects a patient's vision. Myopia. Myopia, also referred to as nearsightedness, is a vision disorder that occurs when the light refracted into the eye focuses in front of the retina instead of directly on it. This condition is often the result of an eyeball that is too long or a cornea that is too steep. People with myopia see nearby objects clearly, but distant objects appear blurred. The opposite of myopia is hyperopia. Hyperopia, also known as hypermetropia or farsightedness, is a vision disorder that occurs when the light refracted into the eye focuses behind the retina. This condition is often the result of an eyeball that is too short or a cornea that is too flat. People with hyperopia see distant objects clearly, but nearby objects appear blurred. Astigmatism. Astigmatism is a vision disorder that occurs when the light refracted into the eye does not form a distinct point of focus on the retina. This condition is often a result of a toric curvature of the cornea or lens. People with astigmatism experience blurred vision when viewing distant objects as well as up close. Presbyopia. Presbyopia is a vision disorder that occurs when the eye progressively, with age, loses the ability to focus on near objects. This condition is the result of a loss of elasticity of the crystalline lens, which over time gradually begins to harden, resulting in the inability to change shape and focus sharply at a near distance. Similar to gray hair and wrinkles, presbyopia is caused by the natural course of aging and begins most often between the ages of 40 and 50. People with presbyopia see distant objects clearly, but nearby objects appear blurred. Cataract. A cataract is a clouding that develops in the crystalline lens of the eye and obstructs the passage of light. Cataracts can vary in degree of severity from slight clouding to complete opacity. Cataracts develop for a variety of reasons, including long-term ultraviolet exposure, exposure to radiation, and as secondary effects of diseases such as diabetes, hypertension, and others. They can also be the result of an eye injury or trauma. Cataracts typically progress slowly to cause vision loss and are potentially blinding if left untreated. Wearing lenses that provide UV protection will reduce an individual's chance of developing cataracts at a young age. Emmetropia. Emmetropia is the opposite of a vision disorder and is the medical term used to describe the condition of a normal eye that focuses rays exactly on the retina, resulting in perfect vision. People with emmetropia see clearly at all distances and require no vision correction. Understanding these basic visual diagnoses will help you make recommendations for your customers that will result in optimal vision.